Good morning, everybody. Happy Wednesday morning to you. Anyway, welcome to my image evaluation series. Today we're going to talk about thoracic spine. We don't do a ton of thoracic spines, but we do them, and they do take a lot of practice to get proficient at. The way the body lays, especially for the lateral, sometimes it's difficult to get all 12 thoracic vertebrae. Like I say, it just takes practice and learning your landmarks. And let's just get started here. We'll run through. We're going to use the same PACEMAN acronym. So let's start with the AP. So we know for a thoracic spine, we shoot an AP, a lateral, and a swimmer's view. We always shoot the swimmer's view with the thoracic spine just for the fact that we can't see T3 through C7. So it's important that you learn and become proficient with the swimmer's view. So let's look at an AP. Okay. So the position looks like the position is fairly good. We can look at the clavicles really meet the sternum right here, and they're both pretty equal. I don't see a lot of rotation there. Position is good. The area, we do have, it looks like 12 thoracic vertebrae. Go down here, find the last rib, and start counting up. So we can see a rib coming off of this vertebral body right here. So we got 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, and then we go C7, C6. Okay, so yes, we do have 12 thoracic vertebrae on there. In a perfect world, we could have our central rate could have been a little bit lower, and we could have gotten L1 as well, which is what you want to do. You really want to see C7 to L1 if possible. But this is sufficient. I know we're centered a little bit high, and we're only catching the T12 vertebrae, but we can see what we need to see on that image. Okay. Collimation wise, we've done it pretty good. We can see that the patient maybe isn't straight on the table, or the tube was turned, or the collimator box was turned a little bit. It just doesn't look straight in the view box there. But collimation wise, we've done a pretty good job. We're nice and tight. We don't see too much. Our picture is actually really nice. It's not light or grainy or anything like that. So let's look at the exposure on this film. The exposure is really nice, actually. We can see the thoracic vertebral bodies really easily. We can see the intervertebral spaces very well. Okay. We can see pedicles on almost every thoracic vertebrae. Those are those little circles right there that are staring at us. Those are pedicles. And then the spinous process is right down the middle. You'll note that up here on T1, T2, it looks like an owl. We've got two eyes and a nose right here. It looks like an owl beak. Just a little fact for you, on the T-spine particularly, if one of these pedicles is closed, they call it the winking owl sign. That can tell us that maybe this person has some sort of metastatic disease, some osteolytic type metastatic disease, like from lung cancer or breast cancer. It can be kind of scary. It can also tell us that maybe the patient is suffering from tuberculosis. But we can see that these owl eyes or pedicles are wide open. We can see the ribs coming off each vertebral body here. Soft tissue wise, we can see a lot. There's good sharp edges on the bones, good contrast, so good exposure for this picture. we can see the air-filled trachea coming down and bifurcating into both lungs. We can see the heart shadow over here on both sides of the spine. We've got the left and right hemidiaphragms. Down here you can see some staples from a gallbladder removal. But yeah, all in all, a really good exposed picture. We do have a marker. It's a right marker. Looks like it was placed post-processing. But we know what side is what. So good job on this exposure. Aesthetically speaking, this is a nice picture. It's a nice APT spine. The only thing I would do differently on this one is center a little bit lower, just so we can catch L1 if we can. So anyway, good job on this one. Let's move on to the lateral. Okay. Position-wise, we're pretty good. So down here, you can see the pedicles coming off of the vertebrae right here, pedicle, pedicle, pedicle. Okay. We can also see that the ribs are superimposed over each other, so the patient is pretty lateral. Once you start getting those ribs waving out, you need to look at your position a little bit. But this is a nice lateral as far as positioning goes. The area, we can see a pedicle coming off. We can see a rib coming off of this vertebrae right here where we can't see it there. So I'm assuming this is T12 right here. So T12, 11, 10, 9, 8, 7, 6, 5, 4, 3. So we can see up to T3, okay, but we can't see 2 or 1 or C7. That's the reason that we do the Swimmer's image, right? Collimation wise, pretty good. Yeah, they've actually followed the spine with the collimator box, which is a good idea. We're able to see exactly what we need to see. We can see soft tissue posteriorly here, and anteriorly we can see what we need to see. We can see the entire spine, thoracic spine right there, up through T3 anyway. So good job collimating. Exposure wise, it's pretty nice. You guys are going to find as you go forward that T-spines are tough to get, and the reason being is we've got ribs coming down, and those ribs are superimposed over each other. So we're actually looking through 2 sets of ribs there. Sometimes it can be a jumbled mess, but we've done a good job of blurring those ribs out so we can see the vertebral bodies through those ribs. We can see the anterior margin of the vertebral bodies. Okay, pretty nice. It makes kind of a crescent, half moon type thing. We can see the soft tissue heart, the space between the heart right here, and the anterior portion of the heart. Like I say, those ribs are stacked on each other, so pretty nice. You'll note that this space right here and right here and right here, that's called the intervertebral foramen. Just so you know, if you ever wonder what that space is. We can see the complete vertebral bodies, and the edges are lit up a little bit. You can see the intervertebral space is really nice. So the exposure on this picture is really good. I'm assuming that we used a little bit of a longer exposure time, which allows us to kind of blur out the ribs a little bit. Okay. Yep, we got a marker on there. It's a left marker. We do a left lateral for a T-spine as we do with most things in X-ray. Aesthetically pleasing picture. It's a nice looking lateral T-spine. And be patient with yourself. Give yourselves a little bit of grace going forward when you're doing T-spines, because you're going to miss a few lateral T-spines. It's a long set of spine, right? So your positioning has to be pretty good in order to get all 12 vertebral bodies on your picture, and you're going to figure out tips and tricks. You can go. I'll be releasing a positioning video on thoracic spine here in the next couple weeks, and I'll give you a couple tips to be able to get the entire T-spine on one film. So anyway, nice lateral T-spine. Okay, and like I said before, we're going to be shooting a swimmers on a T-spine every time. Okay, just so we can try and see C7 through T3. Okay, here's a swimmers on the same patient. Just a little thing that I try to do when I shoot my swimmers is I'll open my collimator vertically a little bit, because I like to catch C1 just for landmark, just for the landmark, so I can tell what vertebrae is what. It's kind of hard to tell, and we can see the bottom angle of the mandible right here, so I know that C1's up here somewhere. We can also go off the pedicles, or sorry, the spinous processes that come off the back of the spine here. We know that the large one comes off of T12 and T1 and C7. So we've got one here and one here. So I'm assuming that this is T12 right here. Just as long as we're able to see that those vertebral bodies, we'll leave the knowing what's what to the radiologist and the provider. But it is always a good idea that we know what we're looking at as well. Okay, so I'm guessing we're seeing C2, 3, 4, 5, 6, 7, and then we're going down into a kind of a jumbled mess, because we're shooting through the shoulder right there. It's kind of hard to see through that, but this is the area that we're interested in right here. Okay, and we're able to see fairly well. So position wise and area wise, we've done a pretty good job. Collimation, like I say, I like to collimate a little bit higher, just so I can see C1, know what I'm looking at. So this could have been centered just a little bit higher, but exposure wise, we're about as good as we can get. If we can punch through that shoulder area and actually see vertebral bodies, we're doing pretty good. These swimmers views, they take a lot of practice, and I urge you to get proficient with them. I know that we don't do a ton of T-spines, but we do a few C-spines, and every once in a while you'll have to shoot a swimmers on a C-spine. So marker, yep, we've done a left lateral swimmers view, so we've got a left marker up there. So aesthetically speaking, it's pretty good swimmers. I've seen a lot worse. I have seen a little bit better, where you can see that spine all the way down through T3. But all in all, pretty good picture. I wouldn't redo this one. I would have no problem sending this into to the radiologist. But this is what you need to see on a T-spine, guys. Just make sure that you're getting all 12 thoracic vertebrae, and become familiar with the landmarks to know the difference between T12 and L1, or C7 and T1. Okay, know what to look for. But yeah, practice these, get proficient with them. I know when I was in school 100 years ago, T-spines were one of my nemesis. They were kind of tough for me. Now I don't mind them at all. Anyway, thanks for stopping by. I hope you're enjoying this evaluation series, and hopefully you're finding it helpful on what you need to see on your images. Anyway, have a good rest of your week, and have a great weekend. And we'll be back next week. We're going to talk about L-spine, so that's pretty exciting. Anyway, have a good day. We'll talk to y'all soon.